Thank you, Speaker. My question is for the Premier. Ontario is facing a housing affordability and a mental health care crisis. And, Speaker, the two are linked. Estimates are that up to 50% of people who are unhoused live with a mental health condition. Mental health professionals are clear that the lowest cost way to improve these people's lives and mental well-being is to provide them with safe, affordable housing. Stable housing with access to mental health, addiction, and other supports. Our green housing and mental health strategies commit to building 60,000 permanent supportive housing spaces. So, Speaker, will the Premier support our plan by committing the necessary funds in the spring budget to build 60,000 permanent supportive houses over the next decade?
Minister of Municipal Affairs and Housing.
Speaker, and through you, I want to thank the member for Guelph. You know, a real opposition question here in the legislature today. I want to build upon the success, and all the Minister Thibault can provide some commentary on the mental health piece, because they do go hand in hand. Speaker, the member is absolutely right. That's why early on in the pandemic, our government worked very diligently on the Social Services Relief Fund, which provided a significant amount of dollars to our municipal partners so they could deal with the most vulnerable population. Earlier this week, I was with the member for Whitby, our Chief Government Whip, where we announced the consolidation of our community homelessness programs, our 3 programs into one, to make the programs more easily accessible for our municipal partners. And we also built upon the existing success by providing even more dollars to our municipal partners. But again, Speaker, we're looking for this member's party to support our fair share call to the federal government. We're being shortchanged $490 million. It could go a long way with your support for us to get those.
Thank you. Thank you. Thank you very much. Supplementary.
Speaker, let's be clear. The housing crisis is getting worse, not better. Over 16,000 people on any given night in Ontario are unhoused. If we want the federal government to put money into housing, the province has to step up as well. And that's exactly why I'm asking this government to put money on the table in the spring budget. And let's be clear, Speaker, an investment in housing is the most fiscally responsible approach to addressing this crisis. For every $10 spent on housing, it saves government $21.72 in social justice, health care, and other costs. But more importantly, Speaker, the improvements it makes to people's quality of life and their mental well-being is priceless. So we know that the solution is permanent supportive housing. So I will ask the Premier, the Finance Minister, the Treasury Board President, will you commit to funding 60,000 permanent supportive housing spaces in the spring budget?
The Associate Minister of Mental Health and Addictions.
Thank you, Mr. Speaker, and thank you for that question. As has been pointed out, housing is an important part of the continuum of care, but there has to be a continuum of care. And one of the things our government has done from day one is build a roadmap to wellness to address the very issues of everything from withdrawal management to treatment to supportive housing and all other forms of housing necessary in order to help an individual, because the underlying issues, the social determinants of health, must be addressed. And, Mr. Speaker, since 2019, we've invested over $500 million in new mental health and addiction supports. And, Mr. Speaker, this is truly an historic investment on behalf of this government and on behalf of the province of Ontario. The investments that we've made are part of that $3.8 billion commitment that was made from the very beginning, and will continue to make investments to ensure that that continuum of care is dealt with. But rest assured, until we have that continuum of care, we need to invest and ensure that people everywhere in the province are getting the help they need and deserve.